I know you aren't wanting decreased energy, weight gain, pain, unexplainable digestive issues, inflammation, declining hormones, plummeting libido, elevating cholesterol, blood sugar, and blood pressure. But the reality is, most adults prematurely develop these health concerns that wind up interfering with their quality of life and the ability to enjoy the activities that define who they are. Likely you've gone to your doctor for answers and a solution, and instead you just got another prescription and no explanation. Or maybe you were told that these concerns you'll just have to live with. You wouldn't be alone in feeling that you weren't really heard or you weren't taken seriously. Being plagued with disease, feeling horrible, aging prematurely, not having the energy to be productive, and having a bag of medications, although common, is not normal. I'm Dr. Ayo Bankole, founder of the Inland Naturopathic Wellness Center, and I'm here to let you know that there is a solution to what you're going through. It's just not found in what you've been offered so far. You see, the conventional model excels in standard diagnoses and in managing health crises like infections or trauma, but falls short in improving chronic disease. Unfortunately, our insurance model of medicine isn't well suited for chronic disease. What happens in this space is primarily suppressing symptoms without looking further. But my team and I believe you deserve so much better, and I know better is possible. A bit about my story and why I practice medicine in the way you're going to hear about. I have 10 years of medical experience in the emergency department and urgent care. Why I observe that people often cycle from the emergency department to their doctor or a specialist and often back to the ED again. And let me tell you, the most common medical emergency is really chronic disease that has gotten out of control. This rotation between doctors and patients will most likely be offered increased medications or given medications in a different drug class, but never really provide a comprehensive top-down strategy that includes nutrition and lifestyle or looks to evaluate and treat the cause of your concerns. That's why we do things differently here. It's why in our over a dozen years, we've helped hundreds of people year after year by providing a health strategy that not only provides an explanation for what's wrong, but a plan to fix it, helping our clients to get their lives back and helping them off of unnecessary medications. Just like Michelle, who was 54 when she came in, she was increasingly anxious and irritable, overwhelmed, and somewhat depressed. She was also experiencing horrible hot flashes, night sweats, daily headaches, fatigue, and even poor memory. She wasn't confident with her doctor, who had said her labs were normal and wanted to write her a prescription for an antidepressant. Michelle knew that was not right. The labs she brought in were incomplete, so we completed the picture and we found that her estrogen and progesterone were very low. These combination of levels gave her horrible menopausal symptoms, but also leads to premature aging, bone loss, and increases a woman's risk of heart disease. Within a few short weeks of addressing Michelle's hormones, she reported feeling so much better. She was less irritable with her husband. She was now able to get through her days without any headaches, and the hot flashes were now at a minimum. Michelle was so happy to no longer be suffering. Then there's Josie, who was 47 years old when she came to see us. She was in a lot of pain from her rheumatoid arthritis. She had seen so many different practitioners and had gone down the rabbit hole by doing multiple things on her own, and she felt that she had wasted a lot of time and resources, which made her feel hopeless. It all took a toll on her confidence, especially since she wasn't able to be active for the past 2 years, which led to weight gain. She struggled, of course, with joint pain and stiffness. She was unable to sleep also, and she had lost her energy. What frustrated her most was that she couldn't keep up with her family. Well, once we did her comprehensive labs, we found that she had too much inflammation. Her progesterone was low, which was contributing to her poor sleep, low energy, and the inflammation. She also had deficient B vitamins and vitamin D, which contributed to her low energy, her sluggish metabolism, her pain, and the inflammation. And what was most critical was that we learned that she had intestinal permeability, which wasn't even considered by her rheumatologist. This was such an important finding as it revealed the connection between her gut health, the inflammation, and her autoimmunity. Identifying these hidden imbalances led to her recovery. We addressed her concerns by correcting her imbalances and healing her gut. The improvement was unmistakable. Josie noticed less pain and stiffness. She became able to sleep straight through the night, and she had full recovery in her energy. She began to once again feel like herself. And there's Anthony, a 57-year-old man who was frustrated because the results he was getting for his blood pressure, increasing doses of 2 medications, very rarely gave him acceptable numbers. His bad cholesterol was high, his good was low, and what he had done hadn't helped. His most recent labs showed increased glucose also, and lastly, he had lost his energy and found that working out became a major chore instead of enjoying it the way he used to. Also, both he and his wife were concerned about his heart health because Anthony's father and older sister have heart disease. Well, review of his nutritional intake and lab testing revealed features and deficiencies that contributed to his high blood pressure, high sugar, and cholesterol. And with that information, Anthony started a nutritional protocol that corrected the deficiencies to address his glucose, blood pressure, and cholesterol. He started natural therapy to lower his blood pressure and cholesterol also, and within a few short months, Anthony's blood pressure was healthy, and we were able to discontinue one of his medications and reduce the dose of the other. And by this time, his energy was back and he was exercising regularly. And within 5 months, his cholesterol and blood sugar were absolutely normal. Anthony was happy and he felt confident that he had reversed so many of his cardiovascular risk factors. So here's how we get these kind of results. First, by providing the time for our clients to truly be heard and understood, to perform advanced testing to identify key roadblocks, deficiencies, toxicities, and dysfunction, and to consider non-standard diagnoses, because we know that what you're experiencing isn't normal and we know that there's a solution to it. We also do this so you can receive comprehensive, customized therapeutic and self-care recommendations that emphasize targeted nutrition and lifestyle, effective integrative therapies while receiving the amount of support you need. We are fully committed to the idea that you deserve better. Now, one challenge that some have is in assuming or thinking that health insurance is supposed to cover all of our health needs. Well, if we're honest with ourselves, we know it doesn't work that way. When it comes to health insurance, we have to think of it like any other insurance. It kicks in when there's a breakdown or a failure, like homeowners insurance. It doesn't pay for home improvements. It doesn't even cover maintenance. It doesn't cover to replace air filters, a fresh coat of paint, or worn out floors. Well, it's no different with health insurance. It won't pay for non-routine labs, for functional nutrition, or any wellness, anti-aging, or regenerative health strategies. On the other hand, for example, when heart disease is advanced enough, it will pay for open heart surgery. Yet it doesn't pay to enhance your health, so you don't need open heart surgery. Which one do you think saves the most money? Prevention, of course. Think about it that way. Now, I want to be fair. Health insurance covers catastrophic events and basic low-cost maintenance and prescriptions, but we know that won't save us from chronic disease. We have the most expensive and in many regards the most technologically advanced healthcare in the world, yet we have outcomes no better than most developing countries. We get asked all the time, will my health insurance cover my care with you? I'm going to ask you instead to consider how much you value your health. Is it important enough for you to go outside of the insurance model? Well, your health is your most valuable asset and your most important investment. The only right answer is yes. We routinely justify spending money on material items that make us feel good in the short term, so it's more than fair that you invest in something as important as your health. We know that optimal health is possible, so here's what to do to find out if we can help you achieve it. Schedule your complimentary call with one of our doctors and complete your brief health questionnaire before our conversation. And on this call, we're going to talk about your concerns, and as long as we can help, we'll invite you in for your first visit with us. We help men and women of all ages, and we help them with a majority of health concerns. We focus on reestablishing hormonal balance, providing and optimizing heart and brain health, digestive and skin health, as well as immune wellness. We are looking forward to helping you achieve the health that you deserve.